back pain, does that automatically mean the disc is herniated, or what are more specific symptoms?
No, it does not mean automatically, Peter. Actually, your question is very good because you have started about herniated discs and so on and so on. But at the last point, you have mentioned the symptoms, and actually, this is the first point: the symptoms. Which symptoms the patient have, and do they have any complaints at all? Because if you would take 100 people on the street and to perform the MRI of a lumbar area or a cervical area of the spine, you will, in 2/3 of cases, you will see some degenerating, aging issues, some bulging discs, some protrusions, and so on and so on. And especially in the countries where MRI is available on the patient's request and payment, and not on a medical appointment, not on the order of doctor. People like to go to the MRI to scan the bodies and so on and so on, and they take the findings, the reports, they read it, they do not understand at least half of it, but they are deeply impressed. Wow, I have herniated disc and so on and so on, but this patient had no symptoms at all. So this is the main issue, the symptoms. If we have a problem with the lumbar spine, let me say, so if we speak of back pain, in absolute majority of the cases, there is not a herniated disc. This is a problem of the facet joints. If I can take a model, 3D model of the spine. So on the back, we see at every level, on the left, on both sides, on the left and on the right sides, we have so-called facet joints, where two segments of the spine join each other. And these facet joints, in the aging conditions, they are degenerated, and they can cause a back pain. So this is the most common issue of a back pain. If we speak about the symptoms of herniated discs, so herniated discs cause the compression of the nerves. You see the yellow one, the nerves which are in spinal canal or exit the spinal canal. And this compression of the nerves cause pain which is irradiating into the leg or into the arm, if we speak about the cervical spine. So this is the most common symptom, the pain, this irradiating pain which irradiates into the leg according to the area the nerve is responsible for. And there are also two more symptoms. So loss of sensitivity in some area, like in some medial area of a foot or something like this, and the loss of some motor functions, moving, lifting of the foot, or pressing of the foot, or moving the knee, and so on and so on. So these are the symptoms of the herniation, of the disc herniation.
Mm-hmm. And if there are these symptoms and the patient needs a surgery, can you maybe explain what is done during this surgery?
Yes. Before we speak about surgery, Peter, let's speak about this cohorts of the patients. Which patients need to go for surgery?
Okay. Fair enough. Yeah.
Because this is very important. If we have only the pain, without loss of sensitivity, without motor deficit, just the pain. So first of all, we need to look how long the patients do have a pain. So how long is the pain history? Sometimes the pain is very severe, very acute, and very disturbing. The patients are immobilized, they cannot get up from the bed, and so on and so on. but this is a condition which lasts for 1 week or several days. And these patients do not have to be operated if they have only pain, because in a proper therapy, that means non-steroid medications, atopic X-ray or CT-guided infiltrations of affected nerve, physiotherapy, in this setting of a treatment, about 80%, the patients, within 2-3 months, they reach exactly the same quality of the life which was before the onset of the disease. So they do not have to be operated. And we have to operate only those patients who did not benefit from this non-surgical treatment, okay?
Okay, so first
this is very important.
Okay.
The second point is, if the patient has, besides this pain symptoms, has neurological deficit, if he cannot elevate a foot or move a knee and so on and so on. So if the patient has some paralysis and so on and so on. So this is the individual decision, how severe, how bad this neurological deficit is. So sometimes it is still possible to continue non-surgical management and the patient profit from and recover. In some cases, we need to go for surgery even within a short history. And now, if we speak about surgery, there are several ways. It is individual decision. Mainly, there are 2 ways to do lumbar disc surgery. It is endoscopic disc surgery. So we operate using a small incision and with some endoscopic tubes. This way is not always suitable. If this way is not possible, so we perform a so-called microdiscectomy. This is a microsurgical operation. This is an open operation with a little bit longer skin incision, where we go from behind between 2 bony arteries of the spine, and this is a natural window by the nature. So we have just to drill a little bit, 2 or 3 millimeters of that window to enlarge it, and then we have our approach to remove this herniated disc. It depends a little bit how fresh, how soft it is. Sometimes the part of the disc is laying just in the spinal canal, so we can just take it out. Sometimes we need to scrub the disc a little bit to take out this degenerated tissues and so on and so on. But the aim of this surgery is to decompress the nerve. In order, we have to have it at the end of the surgery the situation that the nerve is free of any compression and blood supply is good. Okay.
Mm-hmm. So if I may summarize, 80% of herniated disc problems can be, let's say, solved or managed with non-surgical treatments.
Yeah. If the patient goes to the doctor without waiting for chronification of the pain and so on and so on. So 80% of this herniated discs, they don't have to be operated.
And then the remaining 20, there are 2 ways, endoscopic and
microsurgical.
Thank you very much, Professor. It was great talking to you. I have learned a lot, hopefully our viewers as well. And
thank you, Peter.
Thank you for your time.
Thank you.